really warm welcome to you all. My name's Emily and I'm the manager for the Emerging Minds Network based at the University of Oxford. And today we really wanted to share with you our work in progress really on this new project, which is our co-road project. And really it's all around considering how young people, particularly those 11 to 16, have been impacted by the current pandemic and really thinking about how we can support them, really thinking about what resources and support might be helpful. So I'm going to introduce various colleagues as we go through the presentation. So I won't do lots of introductions now, but I did want to mention to you that we're really lucky today to be joined by four different artists today. So I'm going to introduce Tom Bailey shortly, who's going to be doing some sketch notes as we go through the webinar today. But we're also joined by Tem, Freya and Ronnie, who are three artists from one of our partners, Fully Focused, who will be trying to capture something about what we're discussing in a very visual way. So you might not be able to see some of their work as we go through the meeting, but hope you'll be able to share that with you in the coming days. But I was just going to hand over to Tom just to quickly mention how you'll be working today, Tom.
Hello, I'm Tom. So I'll be drawing pictures throughout the session about what you're all saying. I just wanted to say hi. So if I drop into a breakout room, I won't say much. I'll just sort of listen. So that's who I am. Yes, so hopefully we'll get a good, I'll share my screen at the end so you can see a few of the pictures I've created, and then after the event we'll see all the pictures that the other guys have done too.
Fantastic. Thanks so much, Tom. Lovely to have you join us. I'm really looking forward to seeing what our colleagues from Fully Focused as well produce. So in terms of what to expect today then, I'm going to obviously just briefly introduce a little bit about the project. We're going to be sharing with you our work in progress, so the research synthesis that's ongoing, and we'll share where we're at with that. We're also going to be hearing from members of our Young People's Advisory Group. So we've been doing a lot of priority setting work with young people, so we'll be sharing what we've done and what young people have been saying. We're lucky to have one of the members of our Young People's Advisory Group, Cassie, joining us to share some of her reflections. And then we'll have time at the end. If you can stay, we'd love you to, because we've got time for some small group discussions where we'd love to hear your reflections. So based on your experience, what's going on for young people 11 to 16 at the moment, and perhaps what are you working on, what resources have you got you think that would be helpful that we can share with colleagues. So I really hope you can stay with us for that section as well. So yeah, a little bit about the project. So I think so just kind of multitasking, because trying to just let people into the waiting room as well as we go. So so some of our, we're working with a really great team on this project who we wanted to mention, and quite a few of our colleagues are joining us today. So we're working, obviously we're based at the University of Oxford. We're also working with colleagues up in Glasgow at the University of Glasgow and the Triumph Network, University of Reading, but also some fantastic charity partners. So the McPin Young People, the McPin Foundation's Young People's Network, Headliners UK, Fully Focused, Production, Centre for Mental Health and Young Minds. And we're really grateful for support from the Medical Research Council and the Westminster Foundation for this work. So just quickly going on to the next slide then, just to give you a bit of an overview of what the project's about. So really the first element is really about trying to draw together the evidence on the mental health and wellbeing impacts of the pandemic on young people aged 11 to 16. So just trying to make sense of that, do some rapid synthesis. And as you'll see, it's a work in progress, because there's an awful lot of work that's ongoing and that's being published all the time. And then we're working with young people to identify the priority areas that they think are needed. So kind of trying to check in with them, what's going on for young people aged 11 to 16 right now. And then we're really excited to be working with quite a few partners to actually develop some resources that respond to those priorities. So our key partners in this are Headliners UK and Fully Focused Productions, but we're really lucky to be also working with a number of other partners as well, and hopefully we'd love to work with you too. So I think that was all I was going to say about the project. As we go through the meeting, please do mention any questions you've got in that chat box. We'll try to answer them as we go through. Yeah, and really, I was going to hand over to Rebecca Watson, for the next part of the session. Thanks, Becca.
Great, thanks, Emily. Yeah, so as Emily said, we're working with young people on this project. So we've got an advisory group, which are really in of the project and where we're going with it. So I just want to have a really quick video here from one people members. She's just going to tell us a little bit about what are the kind of key priorities and the main issues around mental health and well-being for young people aged 11 to 16 at the moment.
The pandemic has caused feelings of stress and anxiousness due to the sudden changes to young people's daily life. For example, their routines drastically changed as they weren't going to school, and they might have had changes to their exams and therefore probably weren't able to do any of their hobbies. Research suggests that sleeping and eating patterns might have taken a turn for the worse due to these changes in routine, which can affect how young people are feeling and how they behave. They're also worried about things in the near future. For example, while some students missed face-to-face classes, there were also those who were anxious about returning to school. Those who did feel anxious in busy social situations may have found solace during lockdown and would dread having to face their teachers and peers again. Looking further into the future, however, some young people were worried about the quality of learning over lockdown and how that would affect any further education or job opportunities. Obviously, these are things we don't have answers or perhaps even solutions to right now, which unfortunately only worsens the stress building over it. I do understand that coming up with answers to all the questions that young people might have would be near impossible, but at the very least we need to offer up ways they can communicate freely within and outside their age bracket, like online forums or private discussions. There's also many minorities of people that would feel left out despite the support we give, because it wouldn't necessarily be relevant to them. So having a space to research and talk about people in different financial or mental situations would be a step in the right direction.
Great, so yeah, hopefully you've got a little bit of a sense of some of the issues that you're facing. So we're going to hear a bit later from of our young people advisory group, but before we talk a bit more about our priorities, we're going to take a little bit of a look at what we found from the research so far. So as you can imagine, lots of areas, and clearly young people's mental health and well-being will be affected by the pandemic and in different ways. So according to a report by 1 in 6 children and young people were experiencing a mental health disorder as of July 2020, which was compared to 1 in 2017. So while it's possible that this deterioration might have been a continuation that been seen from previous surveys, the fact that over 40% of young people reported they felt the pandemic had made their mental health worse highlights the potential contribution of the pandemic to this worsening picture. So we've been trying to create sort of a rapid synthesis of what we think the evidence base is telling us about the impact of the pandemic, specifically looking at that kind of secondary school age group of young people, so 11 to 16 across the UK. So we focused on looking at some of the key mental health and well-being sort of changes to daily life and how they might have had an impact on people's mental health, and specific groups of young people that might have been affected differently by the pandemic. And overall, as I'm sure you can imagine, no one size fits all or one really obvious solution. The fine mixed. A lot of young people have said their mental health has deteriorated in some way during the pandemic, but some have actually found their mental health and well-being has improved or has gone unchanged. So on the basis of that, I'm just going to go through a few of the key kind of areas or priorities that seem to be kind of resonating from the research, and picked out kind of a few examples from key organisations about what some of those challenges are and how you've been experiencing them. So challenges and reacted to the pandemic, and the restrictions and changes to daily life are not surprising. One of the areas that keeps kind of coming up is feeling low, isolated, or missing experiencing kind of face-to-face contact with people. And so it's been kind of clear that people have been struggling with this. So around 3/4 of young people said that the loneliness had made their mental health worse, and also that key challenges that young people experienced in that first lockdown. And a large study of over 19,000 conducted in the south of England reported that 30 to 50% of young people were experiencing greater levels of loneliness, feeling more lonely, but around 20 to 30% were actually experiencing less loneliness. And so, as well as that, there's been some evidence suggesting that young people have taken that time during lockdown or during the pandemic to sort of reach out and support family, friends and their community. And as well as a lot of kind of loneliness and isolation, some have enjoyed spending more time at home or more time with their family as well. And a lot of studies have asked young people about feeling quite anxious, stressed or worried during the pandemic. And feeling anxious was one of the top 3 emotions experienced during the lockdown. And the types of things, worries or stresses young people might have changed as we've gone on. So from before the pandemic, some data collected by the Children's Commissioner for England highlighted that young people were experiencing really broad range of stresses around school, bullying, really quite varied. And when they did another survey slightly later on during the lockdown, they found that all the concerns young people were having were centred very much around the pandemic. So either concerns about themselves or others catching the virus, or just concerns or stresses around the changes that the pandemic had caused to their daily life, for example, not seeing friends, education, and also concerns about kind of the future, the longer term impacts of the pandemic for them and what that would look like. And when trying to think about, comparing sort of pre-pandemic stress or worry to sort of how it is the levels during the pandemic, the picture has been quite mixed depending on the research. So in one study that was conducted for Year 9 students in the southwest of England, anxiety levels were actually lower when pandemic when they were compared to how they'd rated their anxiety from before the pandemic. In another study that was run in Scotland, stress levels were comparatively the same during lockdown when they were compared to other stress or anxiety that had been reported by other groups of young people before the pandemic. And a range of studies, including some work by the COVID-19 Psychological Research Consortium, suggests that anxiety levels are higher, have been higher during the lockdown and during the pandemic compared to other young people, again, before the pandemic. And also just when young people were reflecting on how they feel now, pandemic to how they felt before. So quite a mixed picture there, really. And the third kind of key area that's come out from the research is an increase in levels of boredom, unsurprisingly, due to people being stuck at home or being limited in what they were able to do. Being bored and unable to do the things they would normally enjoy was considered one of the worst things about lockdown. And for many, this did make their mental health worse. And a majority of, although saying that, a number of research studies suggest that a lot of young people actually coped quite well to some extent with the changes that had occurred. And in fact, there were possible positive impacts of these changes. For example, young people having a bit more time to be creative, to learn at their own pace, and having a bit more of an appreciation for the things that they had in their life already. But obviously, of course, there are a lot of changes that have had a negative impact on young people. And so for a report from the Children's Commissioner for Wales highlighted that the three highest rated changes that had the most impact were not spending time with friends, not being able to visit family, and at that time during the lockdown, the school closures. So as well as considering what are the key kind of emotions or changes to daily life that might have been impacted or young people struggling most with, we've been trying to think about what specific groups of young people might be more likely to have had a negative experience or been affected differently by the pandemic. And so for young people with pre-existing mental health condition, for a lot of young people, those mental health problems they have reported them to get worse during lockdown and during the pandemic compared to those without a mental health difficulty. And so, you know, charities such as Young Minds highlighted that maybe around 3/4 of young people said their mental health had got worse, but around a tenth of those had said their mental health might have improved. And this was often linked to perhaps the fact that they were not in a situation they were struggling with like being perhaps back at school, or the normal pressures of life were less evident for them at that point. And slightly from Young Minds also showing that young people with previous mental health difficulties described their mental health as poor now that they are back at school, with around that being a rise of over 10% from those from returning before they returned back to school. So potentially some increase when young people went back. Yeah, and just as well, we don't have time to kind of go through this in detail now, but just other groups of young people have also been highlighted in the research that might have been negatively impacted by the pandemic. But there is clearly a lot of work still needed to be done to understand how we can best support mental health and well-being of some of these specific groups of young people. So just going to talk really briefly about some recent data from the CoSpace study, which is headed up by Cathy Cresswell and our colleagues at the University of Oxford. So as you may well know, the CoSpace study has followed young people's mental health and well-being over the course of the pandemic. And they have found, when we're looking in this graph at the whole kind of age group, so all school-aged children, that there might be different trajectories of experience, and that might help to kind of unpick a little bit of perhaps, you know, the different effects the pandemic might have had. So from evidence, there are 4 different trajectories of the course of children and young people's emotional symptoms throughout the pandemic. About half of participants had low levels of symptoms throughout. So this is this kind of bottom line, which is fairly consistent going down. So they started off with quite low levels, and this kind of continued throughout the pandemic. However, for others, symptoms might have increased, and for other difficulties were higher at the start, and this persisted throughout. So just kind of looking at this sort of graph to the right here, when the team explored the characteristics of those experiencing these different trajectories, they found that those who started with high levels of symptoms were more likely to be female and from lower income households. And for all the groups that ended up with moderate or high levels of emotional symptoms, parents reported high stress and high family conflict at the start of lockdown. So these findings highlight the overall pattern that we've seen across the various studies, where experiences have varied, but are likely to have been particularly difficult for those who were already vulnerable to increased mental health difficulties. So now I'm going to hand it over to my colleague Elise, who's going to talk a little bit about our priority setting exercise.
Hi everyone. Yeah, so as Becca described, we've had the findings from a research synthesis about the effects of the pandemic on young people's mental health and well-being, and we then wanted to hear from the young people themselves as to what they thought the mental health and well-being priorities are for 11 to 16-year-olds during the pandemic, and kind of how well they thought the research reflects this. So we worked with young people from one of our project partners, the Triumph Network, to design a priority setting exercise for young people to complete. So young people from youth groups in Wales and the northeast of England, along with a school in Scotland and some individual young people across the UK, completed the priority setting exercise. So in the first task, which you can see a screenshot from on the left-hand side, young people rated the importance of different feelings and emotions that they thought young people aged 11 to 16 would like support with over the coming months. And the feelings and emotions were identified from the research synthesis that Becca was just talking about. And in the second task, which is on the right-hand side, young people rated which changes to daily life they thought were having the biggest negative impact on 11 to 16-year-olds' mental health at the moment. So the changes to daily life that they rated again were selected from the research synthesis. So here you can see a summary of the results from the first task. So it's looking at the thoughts and the feelings and emotions that young people thought that 11 to 16-year-olds wanted support with at the moment. So the feelings and emotions are on the x-axis, and a rating of how much of a priority receiving support for that feeling or emotion is on the y-axis, with a higher number indicating that young people thought that it was a higher priority. And this task could be completed either online or face-to-face and in groups or individually. So the online group results are in yellow, and the online individual results are in blue, and the face-to-face group results are grey. So you can see from here that the key findings from this really are that most emotions and feelings are rated quite highly as something that young people think are priorities. And some are rated pretty consistently across the different groups as being a high priority. So for example, feeling sad and feeling lonely, whereas some are a little bit more mixed. So for example, feelings of boredom, feeling lost, feeling angry, feeling confused. So this slide is looking at the task 2, which asked young people to rate changes to daily life that have the biggest negative impact on 11 to 16-year-olds' mental health. So as with the slide before, the changes to daily life on the x-axis and the rating of the negative impact is on the y-axis, with a higher score indicating a bigger negative impact. So as with the feelings and emotions on the previous slides, you can see that most changes to daily life were ranked as having quite a negative impact on 11 to 16-year-olds. And there are some particular ones which are rated consistently as having a big negative impact across the groups. So for example, changes to their normal routine and changes to schoolwork or exams that have resulted from the pandemic. And some are rated more consistently as having slightly less of a negative impact. So for example, spending more time online. Whereas some are much more mixed between the groups. So for example, the negative impact of having to wear a mask. So this slide, you can see some word clouds that we've produced from when we asked young people who were taking part in this task to describe in their own words how young people aged 11 to 16 might be feeling at the moment. So on the right hand side, you can see this is from 140 responses that we had from our priority setting exercise. The bigger the words, the more often they were coming up. So you can see kind of things like feeling bored, feeling worried, feeling stressed, feeling confused are coming up a lot, feeling lonely. And then on the left-hand side, this is from some work that we did with our Young People's Advisory group. So we asked them to fill it in, and this was a group of 11 to 14-year-olds. And you can see here kind of some similar words coming out. So stressed, confused, feeling anxious. Great. And now I'm going to hand over to Cassie, who is a member of our older Young People's Advisory Group. Who's going to talk to us a little bit about what work the YPAG has been doing.
Hello everyone, it's nice to meet you all. My name is Cassie. I wanted to talk really quickly about what we've been doing over at the Young People's Advisory Group. So we were really lucky to look over the literature review that you've talked about, and we identified sort of a couple of gaps that would be quite important, things like age differences. So obviously it's looking at 11 to 16-year-olds. So we talked about 16-year-olds in transitional periods, whether they're in between houses or moving up to leaving school, things like that. And we talked a little bit about how it's important to discuss the gender biases in reporting, because in a lot of the participants in a lot of the research that's been done were women, and that can be quite a problem. So we talked a bit about the changes to daily life that 11 to 16-year-olds have been experiencing. So one of the big points we made was trying to not treat 11 to 16-year-olds like they're that different from adults, because the change in their life is quite similar to us that are older, in the sense of it's very turbulent and they've lost all this structure, which we're all experiencing as well. In that, we also talked a little bit about the lack of agency and sort of feeling as if you're along for the ride in your life and it keeps happening and you're not really able to take part, and how that leads to this lack of motivation and boredom and feelings of disconnectedness, which a lot of young people are really, really struggling with at the moment. In terms of useful resources in like our session, we talked quite a bit about resources on sleep and young people which already struggle with sleep. We talked a lot about screen use and how before the pandemic there was always a big hoo-ha about too much screen use, and how now everything is done on screens and how to manage that yourself. We talked a lot about time management and healthy habits in terms of eating at healthy times and exercising, things along those lines, balancing your online life. And then again, loneliness came up with us. In terms of sort of types of location, we thought it was really important to consider urban versus rural young people, where they're in entirely different environments. So advice needs to be very tailored for what they need. And one of the really big suggestions was actually coming up with some sort of an app that everyone could access, which I personally thought was a great idea. And then lastly, we talked quite a bit about sort of specific groups which would benefit from getting advice around COVID-19. And a couple of the ones we mentioned were young carers, care leavers, or people in foster homes especially. And then we mentioned sort of the less appealing research types, I think was the term used. So sort of young people involved in gang communities or violence. And then in a more mental health specific, we talked quite a lot about inpatients that are under CAMS and how they're often really struggling being in hospital, and how that change will have had a really big effect on how they're dealing with the pandemic itself, and hospitals are inherently dangerous and things along those lines. So it was a really useful session. There were quite a few of us there, which was really nice. And I feel everyone had the ability to say something, anything they wanted to say. It was really open. So I really hope we can contribute further to this developing well. Thank you.
Great, thanks very much, Cassie. That's really, really helpful and really interesting to hear your reflections there. So I was just going to kind of just summarize a little bit more about the kind of YPAG group as a whole, some of the key priorities that they came up with in terms of producing resources. So on the basis of all these discussions that Cassie's mentioned, and also thinking about the research and the previous priority setting exercises that Elise also talked through. So for our younger YPAG group, so they were young people 11 to 13, 14, some of the key things that they came up with was focusing on helping young people with stress and anxiety, supporting people with feeling isolated, feeling trapped, lonely, coping with stress around exams, schoolwork, how to deal with social distancing restrictions and missing seeing family and friends, and support for worries and uncertainty around the future specifically. And thinking about a couple of them highlighted specific support for people that were being bullied. And the last one, kind of how young people can use social media to stay connected as well. So thinking about how we can use that in a positive way. And from our older groups, sorry, these might not be that clear, but again, you can see a lot of similarities in terms of focusing on perhaps loneliness, isolation, coping with change, anxiety, uncertainty, and again, kind of feeling connected, and those online interactions as well. And in just sort of more generally kind of maybe managing tips or time management as well came up as more general things, but also more specific areas such as sleep. So it's just a little bit of an overview of some of the key things that they thought would be the most important things to focus on when it comes to producing resources to support young people's mental health and well-being. So collating all that information together, there were 4 things that we sort of taken from that. The first, which perhaps hasn't been really highlighted so far, was just supporting young people with information on how to get these different sorts of help. So providing them with really clear guidance around that. And then the other 3 were some of those really key areas that were constantly being reflected through all those discussions around feeling connected, both online and just also generally in terms of loneliness and isolation, feeling bored, unmotivated and flat, and coping with change or uncertainty, and encompassing some of those concerns around stress, confusion and worry as well. And so once we had that information, we did another poll with one of our project partners, Fully Focused, who asked young people of those 3 areas that we highlighted, which you think young people need the most help or support with during the pandemic. Of course, all of them were really, really important. We can see there was a particular preference for those on feeling kind of unmotivated, bored, etc., followed by changes of uncertainty. And then feeling connected as well. So we're going to continue to gather a bit more information on that. So really helpful to understand what young people think are the things to focus on. And in terms of how young people would like to receive information and support mental health issues, so this is something we're continuing to discuss with our Young People's Advisory Group later this week. And we've had some initial insights from our Fully Focused partners who asked young people this information, and they gave us some insights that a film or some kind of dramatisation would be particularly well received by young people, followed by looking on a website or more factual type of film or podcast, as well as a cartoon. So a few ideas that will be really helpful for us when we're thinking about producing our resources for the project. Okay, so I'm just going to hand back over to Emily.
Thanks so much, Becca. Thank you to Elise and Cassie and Tiasha, who couldn't join us. But yeah, thank you so much for that. So yeah, so now there was a couple of things really before we break out into some small discussion groups, and really that's kind of next steps really. So we'd love to keep in touch with you, and we'd love to involve you in the project. So please do share it in the chat box. If you're working on anything that's relevant, if your organisation offers resources for 11 to 16-year-olds, or you're working on something's in the pipeline, do let us know, because we'd love to be in touch with you about that. All of the kind of slides and outputs, and hopefully some of our lovely images and sketches will be available on our Emerging Minds website, so emergingminds.org.uk. And if you look on the chat box there, you can find a kind of email to get in touch with us. But yeah, so what we're going to do now is we're going to go into smaller breakout sessions, and the questions we're really going to be discussing are quite simple really. So I think we just want to know from you, what do you think are the most important areas of need for 11 to 16-year-olds moving forwards, perhaps from your experience and your programme and your service, your experience, and in addition, what resources or services would you recommend? So it could be something you're working on, something you use, as again something in the pipeline. We'd love to know.
Well, actually, I was thinking this is probably a good point to go back to Tom, who had suggested he might be able to share some of what he's been doing as we've worked through today. Is that okay with you, Tom?
Off mute and put a few wires in so I can share my screen. Okay, let me just press the button and you should be able to see the screen now. Let's see if you can. Everyone see that? Yeah. Okay, so this is some just basic illustrations of the stuff that you've all been talking about. Now you'll see as we go forward, the first bit is around what was presented to you at the start, the idea of gathering evidence. And you also notice that I've been able to put a bit of colour there, but as time goes on, I've just abandoned the colour, and I'll add that later because there's so much coming up. So I'll crack on with that. So these are the key issues that came out of what was talked about earlier: loneliness, anxiety, boredom. These are the three things that spoke to me about young people. So moving on to saying what you've actually done. You've asked young people their priorities online and in person. And again, there's another priority is the problem of school disruption. It seems to be really big. I can't remember the name of the person who said it, but it was some great issues from the young people's group saying that these are the things you need to bear in mind: age, gender, urban versus rural. It's not all just one size fits all. And that was the idea of that. To present this information, let's make a film, either an animation or a live action film. So this is going to breakout rooms. So someone was saying how some young people actually enjoyed lockdown. That was noted, and I noticed a few people said that it wasn't always negative. There's the freedom of the pressure, so that weight upon you. And this sleep came up several times in different conversations, as did emotional literacy, which is about the idea that teaching us to talk about our emotions, which some of us are better than others. Again, that's the more positive thing. So someone who prefers online learning. I think that's about it, but actually I've got a few more, but I haven't saved them on my computer yet. So I'll show you them later if I get a chance. I also should say that at the end of this, you'll get all these slides, but also the guys who have been from Fully Focused, who've been making art as well, you'll get those as well, and they'll be brilliant, I assure you.
Great, thanks very much, Tom. And that did a really nice job, I think, of summing up and pulling out some of the key themes today. And that's right, just to say huge thanks to Freya, Ronnie and Tem, who've also been busy drawing away throughout this session. We're really looking forward to seeing what they've produced, and we'll share that with everybody through the website and our social media. So do keep an eye out for that, but really appreciate them getting involved, and huge thanks to you as well, Tom. So just a few things to say just as we finish up, and the main thing is to highlight that we will share the slides from today, and also we'll compile the list of resources that you've shared in the chat and that we've recorded on the Padlet from the breakout groups, and we will share that list of recommended resources with you all so that you all have access to that. So do keep anything else coming, so pop anything in the chat or drop us a line afterwards, and you can see our study email address here. So please do drop us a line if you have any further thoughts. And really then the only last thing to say is a huge thank you to all of you for joining us. I think we certainly had a really interesting conversation in our breakout group, and I hope you all did too. But we of course also need to say a huge thank you to our funders and our partners. So we're funded by the Medical Research Council and also the Westminster Foundation. So we really appreciate that. We're very much at the beginning of this project, and we're really looking forward to the things that we're going to be able to do going forward with their support. As you've heard, we also have a lot of partners that we're working with. So particularly want to highlight Fully Focused Productions and Headliners UK, McPin, the Triumph Network, the Centre for Mental Health and Young Minds, who it's great to work with on this project, as well as the other members of the leadership group for the CoRay project, many of whom are involved in the Emerging Minds Network too. I'd of course like to thank our facilitators for all their busy work today. So massive thanks to them. And of course the Young People's Advisory Group, who we've obviously heard from Cassie and Tiasha today, so huge thanks to them for taking part in this session. I think their contributions were so helpful, and great to hear them reflecting following their discussions with the wider young people's advisory groups who are working hard with us on the project, and will be back with us again tomorrow to talk about what's come out of this meeting and how we can take things forwards from there. And then finally, sorry about this, it's a bit of an Oscars ceremony, but one last set of thank yous, and that's of course to Becca, Elise and Emily, who've worked really hard to pull an awful lot of work together very quickly for this project. And as we said, it's very much the beginning, and we're really looking forward to working with many of you to keep pushing things forward to make sure that we're producing resources that are going to be as helpful as possible for young people during this tricky time. So thanks ever so much for joining us, and we'll leave you there. Hope that some of you have managed to eat something while you've been with us, or we'll have a moment to do that now before your next thing starts. So thank you ever so much. Bye-bye.